Welcome viewers. Today we are going to learn about canine distemper, also known as hardpad disease in dogs. Canine distemper is a highly infectious, systemic, viral disease of dogs that occurs worldwide. We will continue this topics and discuss etiology and pathogenesis of canine distemper, clinical findings of canine distemper, diagnosis of canine distemper, treatment of canine distemper, prevention of canine distemper. Etiology and pathogenesis of canine distemper. Canine distemper virus is a paramyxovirus closely related to the viruses of measles and rinderpest. The fragile, enveloped, single-stranded RNA virus is relatively unstable outside the host. Infection is transmitted mainly via aerosol droplet secretions from infected animals. Some infected dogs may shed virus particles for several months. The virus initially replicates in the lymphatic tissue of the respiratory tract. A cell-associated viremia results in infection of all lymphatic tissues, which is followed by infection of respiratory, GI, and urogenital epithelium, as well as the CNS and optic nerves. Disease follows virus replication in these tissues. Clinical findings of canine distemper. A transient fever usually occurs 3 to 6 days after infection with canine distemper virus. The fever subsides for several days before a second fever occurs, which may be accompanied by gastrointestinal and respiratory signs. Serous nasal discharge, mucopurulent ocular discharge, anorexia, vomiting, diarrhea, lethargy. And depression. Rarely pustular dermatitis may be observed. Overall, a longer course of illness is associated with the presence of neurologic signs. Typical neurologic signs include localized involuntary muscle twitching, myoclonus, chorea, flexor spasm, hyperkinesia, seizures, including salivation and chewing movements of the jaw, chewing gum fits. Dogs surviving the acute phase may have hyperkeratosis of the footpads and epithelium of the nasal planum, as well as enamel hypoplasia in incompletely erupted teeth. Diagnosis of canine distemper. Diagnosis based on clinical suspicion. Combination of respiratory and gastrointestinal signs. Confirmation of canine distemper is done by reverse transcriptase PCR, RT-PCR, and antibody detection tests. Differential diagnosis of canine distemper. Distemper in dogs can be confused with other systemic infections, such as parvovirus infection, infectious canine tracheobronchitis, infectious canine hepatitis. Treatment of canine distemper. Inpatient medical management to intensive care as indicated. Isolate patient to prevent spread to other dogs. Symptomatic treatment. IV fluids, for hypovolemia, support. Oxygen therapy. Nebulization, and coupage, for pneumonia. Clean ocular, nasal discharges. Broad-spectrum antibiotics. For secondary bacterial infection, because CDV is immunosuppressive. Beta-lactams or cephalosporins are good initial choices. Anticonvulsant therapy. Phenobarbital, potassium bromide, levetiracetam. Prevention of canine distemper. Vaccination. Isolate puppies to prevent infection from wildlife, e.g., raccoons, foxes, skunks, CDV-infected dogs, ferrets. Recovered dogs may shed virus for up to 4 months.